In July 2018, my sister Hallie was diagnosed with stage 4 Ewing sarcoma, a rare and aggressive cancer. Because of this, educating others on Ewing sarcoma is important to me. It is a rare solid tumor cancer that grows in or around the bone. It is an aggressive cancer and its symptoms are often initially overlooked. Ewing sarcoma is treatable and often curable, but from the cancer and treatments, it can be lifelong. What is Ewing sarcoma? According to St. Jude Children's Hospital's website, stjude.org, it is a cancerous tumor that grows in the bones or in the tissue surrounding the bones. It's usually found in the legs, pelvis, ribs, arms, or spine. It can also spread to the lungs, bones, and bone marrow. First, even though Ewing sarcoma is considered rare, stjude.org reports that it's the second most common cancer found in children, with around 200 young adults and children diagnosed each year in the United States. They state that about 50% of all Ewing sarcoma tumors occur in children and young adults between the ages of 10 and 20. It's rarely found in African Americans and Asian Americans. It affects boys slightly more than girls, and it can occur as a secondary cancer, especially in patients who have undergone radiation therapy, although not often. Likewise, the Mayo Clinic reports that developments in the treatment of Ewing sarcoma have helped improve outcomes for people with this cancer. They state that after treatment, lifelong monitoring is necessary to watch for potential effects of intense and rigorous chemotherapy and radiation. Let's look at some symptoms. So, symptoms can vary from person to person. They may include swelling and soreness near the tumor area, which is often mistaken for sports injuries or regular bumps and bruises, low fever that may seem to be caused by an infection, bone pain, especially that gets worse when exercising at night, and limping. Now, the diagnosing of Ewing sarcoma usually starts with a physical exam by a doctor to address physical symptoms. Next, the doctor will order tests and procedures that typically lead to a significant number of additional tests and procedures. As a result, while there are protocols written for the treatment of Ewing sarcoma, they are adjusted to fit each patient and cause. It is treated with a combination of chemotherapy, radiation therapy, and surgery if eligible. Chemo is usually the first line of defense in treating Ewing sarcoma. It is a combination of extremely powerful and toxic medicines used to kill the cancer cells and to stop them from growing and spreading. It is typically administered by IV directly into the bloodstream so that it can spread throughout the body. If the patient is a candidate for surgery, this may be done next. This takes place after many weeks or months of chemo that has decreased the size of the tumor to a point where surgery can be most beneficial. Sometimes surgeons will graft bone or tissue to replace bone and tissue compromised by cancer. Some surgeries may require an implant or artificial bone. In some cases, amputation is necessary to be sure the entire tumor is removed. The next step in treatment is radiation therapy. Radiation uses high-energy X-rays to kill cancer cells or stop them from growing. It's also used to kill or reduce cancer cells that surgery is unable to remove. Radiation is typically followed up by more chemo to help kill any leftover cancer. Radiation is administered in two different ways. External radiation is delivered to cancer sites in the body by machines, and internal radiation is delivered by needles, wires, or catheters into or near the cancer. Currently, researchers do not know what causes Ewing sarcoma. What is known is that it begins during cell development when, for reasons unknown, the cell's DNA changes. Next, according to the Mayo Clinic's website, risk factors may include age. Ewing sarcoma can occur at any age, but most often in children and young adults. And then ancestry. Ewing sarcoma is more common in people of European ancestry and much less common in those of African and East Asian ancestry. Fundamentally, there is a long list of possible complications resulting from the treatment of Ewing sarcoma. These complications can be substantial and can be short or long-term. Some short-term complications are anxiety, depression, allergic reactions, nausea, vomiting, being weak and tired, vision issues, and skin breakdowns. Some long-term complications are relapse, scan anxiety, heart problems, lung problems, anxiety and depression, leukemia, other solid tumors, fertility issues, and stunted growth. Lastly, stjude.org lists the following information in regards to the survival rates of those with Ewing sarcoma. Approximately 70% of children diagnosed with Ewing sarcoma are cured. Teens 15 through 19 have the survival rate of around 56%. Children diagnosed after their disease has spread have a survival rate of less than 30%. Children with larger tumors or tumors located in the pelvis, ribs, or spine are less likely to be cured. In short, while advancements have improved the outcomes for patients with Ewing sarcoma, it continues to be an aggressive cancer that, even if survived, often has lifelong effects.